Hello, now today I'm here to talk to you about cholesterol. Now, a lot of people are diagnosed with higher cholesterol, and typically, the first line of treatment for cholesterol issues would be that your PCP is going to prescribe statins. Now, while statins typically were or traditionally were the first line of treatment, we know now that they come with a lot of side effects after prolonged use, and therefore, now the first line of treatment for high cholesterol is changes to your lifestyle. And that is exactly what I'm going to focus on today. I'm going to talk to you about some of the important strategies that you can adopt to make sure that your cholesterol levels are normal and you don't have to depend on statins for the rest of your life. Okay, so now, first and foremost, you have to go for a plant based lifestyle. The plant based lifestyle, as we've talked a few days before, I believe, was it's not being vegan. It is about making sure that you are really limiting the amount of lean proteins in your diet. You're making sure that you're completely eliminating high fat sources of meats or anything else in your diet, and making your plate more well rounded, well balanced with whole grains, vegetables, and fruits. Second strategy, making sure that you're eating a lot of dietary fiber. So, again, it comes from your fruits and vegetables. Thirdly, making sure that you're completely eliminating refined flour, added sugars, sweetened beverages, and then also making sure that you're making heart healthy fat choices. So, making sure that you eat more unsaturated fat as compared to saturated fat and cholesterol. Now, the guidelines that I'm providing you right now are more generic. We obviously, when we have a patient, we are going to make those changes based on the patient's history, their labs, what medicines they are taking, what other health conditions they have. But right now, I'm going to give you more generic ideas. So, saturated fats, we don't want you to eat more than 7% of your total calories, ideally speaking. Cholesterol, again, we don't want you to eat more than 200 milligrams of cholesterol per day in your diet. And alcohol, now that is a very important question. A lot of the people rely on alcohol, especially for social events. So what we say is typically one serving alcohol for women and two servings for men would be more than enough, especially if you are a drinker. But in general, we would recommend trying to avoid alcohol at all costs, especially if you have higher cholesterol. And last but not the least, your exercise. So exercise needs to be just like your diet. It needs to be a well balanced exercise routine, making sure that you are not falling for any fads or don't fall prey to any unsolicited advice from trainers, health coaches, wellness coaches. Do not take their advice. Do not over workout. You need to make sure that your workout is within reason and make sure that it is completely balanced out. So making sure that your weight is healthy, it is not below what it should be and it is not above what it should be, making sure that your body composition is normal. Those are some of the things that we need to focus on when we have high cholesterol. I know that these are a lot of things when you actually start to apply to yourself, and it's very difficult to understand that, okay, but how much cholesterol do I need to eat, or how much saturated fat should I need, or should I limit myself to? So those are the things that your RDs are going to be able to answer for you. And this is exactly why we say that please make sure that you consult a registered dietitian for any kind of lifestyle changes. So with that, I'm going to end the cholesterol talk today, and then I will be coming back with some other nutrition related subjects very soon.